nitrous oxide inhalation sedation, and nowadays it is termed as the backbone of pediatric dentistry. So I am here before you to share our obstacles and roadblocks in using this magical gas in our routine practice. So, a visit to a dental clinic is always considered to be nerve wracking, be it an adult or a child. Even for me, it is the same. So, there are various basic behavior guidance techniques that is available in pediatric dentistry that can be utilized to make the dental appointment a positive experience for the child. But in reality,
ആരും നിന്നെ പിടിക്കുന്നത് നീ വെറുതെ നീ വെറുതെ ഇരിക്കും നീ വെറുതെ ഇരിക്കും നീ ഇതാ നീ അച്ഛനാണോ നിന്നെ എപ്പോഴും പിടിക്കുന്നത് ആണോ നീ അനങ്ങാതിരിക്കുക
Even for me, with more than 25 years of experience in pediatric dental practice, sometimes even after arriving at an accurate diagnosis and formulating a comprehensive treatment plan, I often fail to execute it to perfection because of behavioral problems and sometimes may end up in providing compromised care. So, when a child exhibits dental fear and anxiety that cannot be managed by basic behavior guidance techniques, it can be augmented by utilization of nitrous oxide inhalation sedation. And its advantages like ease of administration, faster onset, titratability, so that depending on the patient's response, the dose can be adjusted, and quick recovery, ability to communicate between treatment and safety, all make it a nearly ideal clinical sedation. It is actually a compound of just 3 molecules, but it has a long and fascinating history, which many of you are aware of. Up to around 50 years after its discovery by Joseph Priestley, its analgesic and anesthetic properties were not realized, and it was used mainly for euphoric purpose. And now it is a laughing gas, not only for the patients, but also for the clinicians and researchers who are exploring its multitude of actions. And this idea of conscious sedation is not new for us also. It was there in the curriculum even when I was doing my undergraduation. And it got popularized in our country around 10 years back. And it is also being widely used in our state also. And best example is our speaker, Dr. Raju Sani. Our institution procured the equipment way back in 2012 when the postgraduate program was launched. And as Anand said, we conducted a CD, Wake Up with a Smile, in an attempt to familiarize the equipment and procedure amongst us. And our visionary chairman, Dr. Taha, is planning to buy 4 or 5 equipments to make it available in all our comprehensive clinics. And each batch of PG students, many of them are here, have attempted to use it at least in 1 or 2 cases, but it is quite unfortunate to say that only a handful of
പറക്കുന്നുണ്ടാ? പേടിക്കല പേടിക്കല.
So the first and foremost problem that we face is in the ideal selection of the ideal patient for conscious sedation. So according to textbooks, these are the indications and contraindications for using a nitrous oxide inhalation in a child. But in reality, we find some difficulty in selection of cases. And I believe that understanding the basics in fear and anxiety will be a stepping stone towards the success of conscious sedation. And because the main purpose of it is to produce anxiolysis. And the proponents of these conscious sedation, many authors, they are using a term first nitrous visit to imply the visit when the nitrous oxide sedation is first introduced to the child. And according to them, it is as important as the first dental visit. Second program is lack of training. It's the second most issue that we face amongst us. Multiple workshops and CD programs are being conducted nationwide, but no certified programs are there as such on conscious sedation. Even though many of my colleagues and even I had the opportunity to attend various programs, confidence is not that there. Yes. Another area that requires, this is actually the conscious sedation CD that we conducted in 2013, where a delegate was of today's speaker, Dr. Raju. Another area that requires clarification is the presence of an anesthesiologist. The conscious sedation is always a controversial issue when it is considered outside the operation theater and all the more performed by a non-anesthetist. The debate on this is going on in our country, and at present we are doing it in the presence of our anesthetist here. But I realize the fact that Dr. Raju and many others are doing it in their routine clinical setup. The last concern I want to share with you is regarding safety. Although nitrous oxide has an impeccable track record of more than 80 years with nil mortality, there are rumors that spread on social media like these, negating its use. But in all these cases, nitrous oxide was not the culprit. So anxiety about unforeseen medical emergencies that can arise also prevent us from using it regularly on a day-to-day basis. So finally, we often revert to our basic behavior by guidance techniques, or we may skip to advanced techniques like general anesthesia, means we prefer to be in our comfort zone. So these are the roadblocks that I was talking about. And in the forthcoming sessions, Dr. Raju will enlighten us with his practical knowledge and skills to alleviate our concerns on this topic. And there are faculty and students from other departments. So I hope Raju will speak on its use in adults and also in children with special healthcare needs. So let us make some noise and make this day a fruitful one.
Thank you, ma'am. Thank you, ma'am, for enlightening us on the various roadblocks for nitrous oxide sedation. Now, let us
At that time, I think it's the first time nitrous oxide inhalation sedation CD program was arranged in any part of Kerala, I suppose. I think before that there was not there. So, first of all, let me thank the management, Chairman Taha sir in his absence for giving an opportunity, and all the principal Rajesh Pillai sir, Sudhir sir, and especially the pediatric department headed by Sajina ma'am and Professor Ananda sir, and all the faculties having faith in me as a speaker. So let me try my level best to fulfill the hope. So after how I came to nitrous oxide, it's a long story. After my PG, because in my PG life also, during the last year, nitrous oxide was introduced in the department, but it was in one corner of the department. Okay. I suppose in almost all colleges it's the same. But that was not much discovered part. In 2007, I cleared my PG. And in the department, it was taught about all the behavior management technique in pediatric dentistry. So we were very happy with it, but there, except some few exceptional cases. And after my PG, started a clinic where I could manage all the patients to make sure that I can make them calmly sit on the chair. But after giving LA local anesthesia is the most difficult part. And I think all the periodontists and other department staff, everyone knows that giving local anesthesia is the most difficult part to their patients, right? Painless. Yes. So that is the time when the PMS Dental College came with a CD program that two good topics, that is computer control local anesthesia along with nitrous oxide in 2013. I attended, and it was quite useful. And that time, after going back, I directly started searching for computer control local anesthesia, and immediately I introduced it. But still, had lack of confidence with nitrous oxide. Same thing what ma'am has told. The difficulties what we face, the training which we get during our PG or UG time, then the controversies which were there. And I was happy because before that, most of the time I used to go for general anesthesia. If there is a highly uncooperative patient, yes, general anesthesia. But after attending the CD on the computer control local anesthesia, half of that patients I could easily manage to do the treatment on the chair with the computer control. But still, 50% there was a problem. Okay. But after that, I attended some more with Dr. Srinivas Namneni, then with Dr. Sunil Mohammed. And I was still not confident. You know why? Because almost all the machines which I buy in my clinic, I first personally experience. How is it going to work? Same with the computer control local anesthesia. Okay. I asked them, if you can give me a painless palatal local anesthesia, definitely I'm going to buy this computer control local anesthesia. And they were able to do that on me. But why I was reluctant to take conscious sedation unit? Because I was not getting the feel of it. Because they were telling about sedation, then patient is going to be very calm, anxiety, but I was not getting it. I was not getting the feel of it. All right. But finally, one day, Dr. Sunil Mohammed called me, "Do come, we will see with this nitrous oxide. Why is it making you going away from this nitrous oxide?" But that was the first day I got the feel of nitrous oxide. Then I said, yeah, this is good. Okay. Before that, I don't know why. There are maybe many reasons. Okay. So that's how I introduced or I came into nitrous oxide. But still, after having so many trainings also, the fear of doing it, that too especially alone in the dental clinic, it's going to be a difficult task. Okay. That fear you should come out. If you come out of that fear, this is going to be a wonderful magical gas. But again, you have lots of indications, contraindications in all cases. Never think that you can do a pulpectomy or manage a pediatric patient less than 4 years of age. Okay, because you should be able to have good communication skills, right? Then special healthcare needs children with learning disabilities. I will speak about that later in my talk. So fear of dentists, right? How many of you out here say that dentistry is saturated? Saturated? First of all, fine. Still, it's a booming, right? Yes. Thank you so much. I don't have to explain much on to that. Okay. But see, there's what, according to the survey, they say that 21% of the population, they're still outside because of the dental fear. Right? The pain is the most difficult thing a patient ever faces. And because of the pain, what they are going to feel during the treatment, they stay away from the dental treatment. That's what they say. Right? There are maybe many reasons. Okay, I'm not going so deep onto that. Madam has told about that. But let me say, the most sadistic persons in the earth is who? I will say that word, sadistic person. Dentist. Because we have these instruments with us. Right? One is mouth mirror. Okay. If a patient comes to you, they'll say, I have tooth pain on my lower D. First thing what dentist is just see that and then take the other end of the mouth mirror, Centron percussion. Done. Whoever is the patient, who even if they are very cooperative, with that, they are going to have problem. Second thing, mouth probe. After seeing the Centron percussion, they again see that there's a cavity. Just poke it into it. Over. Right. Next thing is needle. Right. It's when a patient comes directly, either your staff or you dentist itself directly showing the needle to the patient. That's another difficulty which we, because all of these things which create the dental phobia or created the dental phobia, right? Am I wrong on it? Yes or no? Yeah. So we need to get out of that fear, or you need to make sure that you should have a generation of patients which is out of this dental anxiety, dental fear. Okay. So before that, let me start, before starting, what is the difference between fear, anxiety, and phobia? Anyone? Yeah, postgraduates. Ma'am was asking me to ask the postgraduate what is the difference between fear, anxiety. That is there, written out there. Can you give an example? Which so that all the interns out here, then other people are there, they can easily understand. Sorry? Okay, leave it. See, when one fine one morning, you are going for a morning walk. Okay, so with earphones on your head and happily enjoying the climate, you are going for a morning walk. Okay, so without seeing the right or left, just crossing the road, immediately a car comes. Luckily, you missed that accident out there, right? So what the fear you have? There's a car out there, okay, and it was very lucky that you missed that accident. Okay, when you see next time in a car, you have that fear in your own. Same way, the mouth mirror which we have, when they have already had a tendon percussion or the needle which they see, okay, so all these are fear factors. Okay, what is anxiety? Same. After that accident, for 1 or 2 months, you are not going for a morning walk. Okay. Again, okay, you got the confidence about it. Finally, you again started with your morning walk. Okay. Before starting itself, you have little tension. Right. Then once you enter into the road, your BP increases. You start sweating. Okay. When you come near that spot where you had the accident previously, you will look up first if there is anything going to fall from the top, right side, left side, right? Because you have the anxiety, whether the car is coming or any other vehicle is coming. So that is anxiety. So you don't have a car out there or source of fear is not there, but still you are having that anxiety inside you. So first time, if a patient, if you make sure that if you make a child cry with tendon percussion or probing or with a needle, okay, next time when they see the environment itself, the dental clinic itself, they have the anxiety. Okay. 2 or 3 times they have that problem, goes to a phobia. Right? What are the challenges what we face nowadays, ma'am has told. So I'm not going deep into it. Okay. And so many challenges, so many new rules which have come. Okay. And the conservative people and the surgical department, they are the one who's introduced two-hand dentistry, four-handed dentistry. But we periodontists have long back introduced 10-handed dentistry. Okay. So you need to change because so many rules have come, so many POSCO Act is there, hand over mouth access is being removed from the pediatric department. Okay, so many challenges are there we face. I'm not going deep into it. So you have a spectrum for pain and anxiety management. Okay, that is from communication. You have the basic thing what you need to do is communication with your child. Okay, any patient who comes to the clinic, have a good smile with them. Okay, communicate him with the child or with the patient directly. Half of your job is over. Okay, if you have too many patients in your clinic, then it will be difficult. Otherwise, it's fine. Then you have audiovisual aids and other methods of behavior management. How many of you can give confidently tell your patient that do you want an LA local anesthesia with pain or without pain? How many? Or have you given the choice to your patient? do you want local anesthesia with pain or without pain? I do that. And they ask me what is the difference. I say charges are different. All right. Because if you have the gadgets with you, you can definitely with confidence, you can give a patient local anesthesia without pain. Okay. And most of the patients, if when I say, do you want a local anesthesia with pain or without pain? Depending upon the charges, they say, doctor, I want a local anesthesia without pain. No one is opting for local anesthesia with pain because the charges are less. No, everyone wants painless dentistry. So this is a child patient, very phobia. It took 3 days for me to make sure that the child sits on the dental chair. 3 days. The third day she sat on the dental chair. Okay. After that, I was supposed to do an apexogenesis or apexification for this child. Okay. But without nitrous oxide, I would have been never able to accomplish my treatment. She is an 11-year-old female child patient. See the condition. It's not that easy. And this is have different routes for giving the sedation. You have oral route, you have IV, IM, and you have inhalation sedation. These are different. Okay, ma'am, I've given the brief introduction why nitrous oxide inhalation sedation is easier when you compare with IV, oral sedation, and IM sedation. So I'm not going deep into that. And I think ma'am has cleared this also. Now, this, is it safe? Okay, over 168 years been used nitrous oxide. Till now, there have been no reports in the literature of death caused by nitrous oxide oxygen inhalation sedation. Okay, these words are important. In dental office, because they use nitrous oxide in operation theater, like mainly in operation theater, along with other sedation methods. They use IV sedation, they use oral sedation, they use inhalation, halothane, all sort of sedations. Okay, different medications they use in OT. Okay, so in dental chair, okay, because other things we are not bothered because they might be doing some other, because every day in operation theater OT they use nitrous oxide as a relaxation method for relaxation of the muscles they use. Okay, because so that the amount of halothane or sevoflurane what they use can be reduced. Right? So in dental office, while a dentist performed dental procedures, not complicated surgeries. Okay, not complicated surgeries, maxillofacial surgery, or I'm not talking about that. Dental procedures, simple dental procedures, absolutely no problem. And nitrous oxide, oxygen as a sole sedative agent, because you cannot combine nitrous oxide with other sedations, oral sedations, IV sedations. Okay, sole sedative agent. Got it? Because most of the time, sometimes the patients might be using drugs. Okay, sometimes they'll be using antihistamine. So you should have a clear history about it. So no other drugs should be incorporated along with nitrous oxide when you are doing a procedure. And exclusive dental sedation machine. Because I will tell you that what are the safety mechanisms which is being used in the dental sedation machine. Okay, there are a lot of safety mechanisms. So that is why it is giving so much of safety for dental procedures. And it should be well maintained, because maintaining the equipment is another important. There can be leak of gas. Okay, there can be other problems like more oxygen or oxygen depletion. So you need to maintain the machine properly. So if these criteria are met, till now there is no casualty. So let's start about the practical aspect of nitrous oxide on this. So don't worry about it. Okay, take out the fear factor from your body. And this is another thing which you have safety factor, MAC value. MAC volume is minimum alveolar concentration. Okay, so for nitrous oxide, to make someone sedate or go to a higher level of sedation, you need 104. 104 is the MAC value. Okay, where your dental sedation machine can give only 70%. Even if you want to make the child sedate or the patient sedate, you can't do it with this dental machine. Got it? Whereas see the MAC value of other sedation, inhalation sedations, they use sevoflurane 2.5. Very little they give. The child or the patient is going to the surgical sedation. Stage 3 of sedation. Okay, halothane. So these are the different anesthetic agents being used and their MAC value. So with the machine which we use and the nitrous oxide inhalation sedation, you cannot make someone go to a higher level of sedation. Right? Fine. Now, what is the scope of nitrous oxide? There's a huge demand nowadays. Right? See, anyone who wants to go abroad, especially in the Middle East countries, for them it is must that you should learn the technique of using nitrous oxide. So that's the basic thing. In endo, in perio, in pedo, everywhere they're asking, do you know how to use nitrous oxide? So it's a huge demand nowadays. And people who comes from abroad to Kerala or India, they ask, do you have a nitrous oxide? And they search in the net and they come. Okay. Then comfort. Comfort, it's not only for the patient, it's for us also. Because last time I had a CD program in my college, Oxford, regarding this nitrous oxide. So see, I said my last year of PG itself that they have introduced the machine, but still now it is on corner of the department. Okay. So I said, get the patients directly. I have given the demo on the patient. So I said, what I said to the department is that first, let you do the treatment. If you want to give a pulpectomy, give LA, do the pulpectomy. Do you want to give a crown preparation and want to give an LA, give the crown preparation. And the second day, when the procedure was done on the same patient with the nitrous oxide, they said, doctor, it's like a lot of difference. The comfort to the patient, for comfort to the patient as well as for the doctor. It is very easy to manage the child. Without nitrous oxide also the previous day they were able to manage. But the time taken to manage the patient, the comfort for the doctor. Okay. So the burned out syndrome, the doctor itself is going to get burned out at the end of the day. So you can get rid of that. Again, comfort to the patient which you are giving. They will be very much relaxed. Right? Then referrals. A lot of referrals I get. Okay. For example, I have a pediatrician in my clinic, sorry, in my hospital. So what he was telling, he was reluctant to go to a dentist because of the fear. So many teeth he had problem. So I said, you come, let's see with the nitrous oxide. And he was very happy with the treatment at the end of the treatment. And after that, I had a lot of referrals, especially his cousin. He is from somewhere in Kollam area. Okay. He had come to Kottayam. Okay. He wanted to do a root canal treatment. But every day, he will go to the dentist, take an appointment. On the day morning, he will call up the doctor and say, doctor, I have another important meeting. I am going for that. He's changing the appointment. And he happily sits, what the doctor is saying, he happily sits at home. He doesn't have any, but he has the fear for the dentist. Okay. So you have a lot of referrals. Then additional income, yes, definitely. Now, who needs nitrous oxide? Who needs? It's not pediatric dentistry alone. All other departments. Okay. The age group, ideal candidate, it's not the younger age group. Below the age of 5 years, it's very difficult to manage because, as ma'am said, it's very difficult to manage the pediatric patient normally. Okay, and the communication which we are able to achieve with the pediatric patient is very difficult. Same with nitrous oxide. Nitrous oxide, you need to have good communication. If you don't have a communication, it's very difficult. So very young children, no. So periodontists out here, don't think that I have come to attend nitrous oxide class. The next day I can do very young children without general anesthesia. No. Fine. Rest all, who you are able to give communication. Then again is a language barrier. A patient who you are not able to have language properly and communicate, even if it is an adult patient. No. But rest all patient requires. Like I said, who wants pain? No one wants pain out here. Everyone wants comfort nowadays. All right. So all age group, whether it is for surgical extraction, you have an orthodontic treatment. Okay. Then you have an extraction, simple extraction, perio flap surgery. Root canal. Sir was asking about how to manage a hot tooth. Okay. Many people are there. See, once they experience pain, because most of the time, when I say a root canal to a patient, doctor, I don't want root canal. Why? I had a very bad experience last time with the root canal. Now I don't want root canal. You better remove it. Or when a parent experienced pain while doing the treatment. Okay, when I say This is pediatric root canal, pulpectomy. It's a pediatric. Doctor, better not to do it for my child because I have experienced the pain. I don't want to go. My child also go through the same way. That's regularly we face, right? So everyone you can give, and very old patients who are not able to come to your clinic. Okay, not able to come to your clinic because most of the clinics either it will be in first floor or steps will be there. Okay? Who are not able to walk into your clinic, they are not ideal candidates. I'll tell you later why. Who is able to come into your clinic directly, okay, without any help of others, they are okay for nitrous oxide. There is no contraindications with any of the systemic disease. Do you have any doubt onto that? This is the place where I get maximum doubt. Can I use it for epileptic patient? Can I use it for patient who have congenital heart diseases, BP patient? Anyone? Any doubt? It can be used. Asthmatic patient, it can be used because the tension is the one or the anxiety is the one who is going to trigger the asthma. Okay, here you are relaxing the patient. So the attack can be reduced. So it is indicated. And again, asthmatic patient, you are see how much, what is the percentage of oxygen normally? It's 21% outside. Here, minimum you are giving 30% of oxygen. So oxygen, what you are giving is more active. So that is fine with the asthmatic patient. Anyone? Mouth breather, no. I'll tell you the contraindication. Yes, contraindications. First thing is, if the patient have got blocked nose, because this is inhaled through the nose. So those who have got blocked nose, they are not the candidate for inhalation sedation. Then they have undergone any surgeries or sinusitis, middle ear infections, or any surgeries, ear surgeries. Because why is that the density of nitrous oxide is more than the air? Okay, air is 1, whereas for the nitrous oxide it is 1.3. So when the gas expands, they are going to have they are going to have pain, severe pain. So patients who have got sinusitis, middle ear infections, they are not ideal candidates. Patient undergoing any, taking any drugs, I said nitrous oxide alone has to be used. If they are using any drug addicts, no. Alcoholic, no. Fine. Taking medications for any other psychiatric problem, psychiatric patient, again they are giving CNS depressants. So any psychiatric patients, psychiatric medications they are taking, they are not ideal candidates. Fine. Okay. No, because I'll tell you the mechanism of action later. Okay, so it is not going into the body. Okay, fine. So these are the indications. It is there. Patients who have got mild to moderate anxiety patients, you can be used. Mild to moderate, but extreme anxiety, you need to manage that. You need to manage the extreme anxiety, like I showed in the video. Fine, you need to do behavior therapy. Then mark gag reflexes. Okay, I have taken many patients who have got gag reflexes while taking impressions or putting the water into the mouth. It can be easily reduced. Then traumatic procedures for cooperative patients also, because you are going for an impaction, larger bone cutting. Okay, you might take little more time consuming for the treatment. So that can be orthodontic extractions. I think this is all I have told. Needle phobia. Okay. Then multiple quadrant dentistry in pediatric patients. When you are doing single side multiple tooth pulpectomies. Okay, that is easily you can do. Inability to understand, very young child. No, because you are not able to have a communication with the patient. Then nasal blockage, psychiatric patient, first trimester of pregnancy. First trimester of pregnancy, there is organogenesis, okay? But still, it is not contraindicated but to be on the safer side, on us, okay? Cleft palate patient, no, okay? Claustrophobia, again, there's a small mass coming into the mask, face, they get more anxiety onto that. So what are the advantages of nitrous oxide? What does nitrous oxide do? First thing is analgesic properties. Okay, it increases the pain threshold. When you give a local anesthesia, the insertion of needle insertion pain, they don't feel it. Okay, increases the pain threshold. Then anxiolytic properties. It has a mild sedation, very mild sedation. So the anxiety reduces, but never make the patient sedated or sleep. Then amnesia. That is the most beautiful part. Even if they feel any pain, at the end of the treatment, when you ask, do you have pain? They forget about it. They forget the time. Sometimes you might have taken 1.5 hour for an impaction or a pulpectomy or a root canal therapy. Okay. But if you ask them, they'll say, so fast it has been finished. So they forget the time, place, and difficulties what they prefer. Sorry, what they undergo. Then onset of action. See, when you go for an oral sedation, the minimum action of time, half an hour to 1 hour time it takes. Same with IV, even if it's fast, okay, the patient recovery time is it's a problem. So here the action is very fast. Okay, 10 minutes maximum. Okay, what they say is 3 minutes the action happened, but for us to do a treatment, 10 minutes. Sir. All right. Then titration. If the anesthesia is more, or if you think that the patient is having more sedation level, or is going to higher sedation level, you can immediately bring it back. It's like on and off switch. Then you have recovery time, very fast recovery time. That's 2 minutes. Elimination, it doesn't go into the metabolic part, so it can be easily eliminated. And acceptance by the patients. Anatomy, what? Because see what happens from higher concentration, it goes to the lower concentration. Okay, so when you inhale, there is a higher concentration of nitrous oxide in the lungs, whereas in the circulation system, it is not there. So from higher concentration, it flows into the lower concentration, goes into the blood, but this doesn't mix with the blood. That's the beauty of nitrous oxide. It doesn't mix with the blood. Okay, so it's like oil mixed with the water. Got it? Goes to the central nervous system, does its action, and once the concentration of the nitrous oxide is less in the lungs, it flows back. It doesn't affect any other system. Its metabolic action doesn't go into the liver or kidney. Right? So it takes through the blood, it goes to the central nervous system, its action. Once the concentration is less, flows back. Okay. Now, this is what you actually require. Okay. The planes of anesthesia or stages of anesthesia. If you know this better, then it is very easy for you to use nitrous oxide. Till here what I said, it's not the part of the practical aspect. Okay. From here, the practical aspect. So basic thing is you need to know the stages of anesthesia. Okay. You have 4 stages. Stage 1, stage 2, stage 3, stage 4. Okay. Stage 3 and 4. With the nitrous oxide, you are not able to achieve. Okay. MAC value, I said 104. You can't achieve stage 3 and 4. So just forget about stage 3 and 4. Now you have stage 1, 3 phases. Phase 1 or plane. Plane 1, plane 2, plane 3. And stage 2, only 1 plane. Okay. So this is the phases, planes of the stage 1, plane 1. So stage 1 is where less than 50% of nitrous oxide. Okay. So it's basically actually from 0 to 25% of nitrous oxide when you give, it is in plane 1. So what do you get in that? Moderate sedation or analgesia, very mild sedation. Okay, you can't say sedation. Then there is an increased pain threshold. Increased pain threshold, slight reduction in spontaneous movements. Then BP or the respiratory rate, it's normal. Your laryngeal, pharyngeal reflexes are unaffected. Patient feels relaxed, less fearful. There may be paresthesia of the fingers. Forget about all this. Okay, forget. This plain one, when you ask someone or when you say, see the movements, you need to see the movements of the patient. Okay, before the action, the blink rates will be very high for the patient. You look at the face of the child, or look at the face of the patient. They have blink rate will be very fast. Okay, and the movements of the body will be very fast. When you ask how many friends you have, it's a normal one. In plain one, when you ask how many friends you have, slight reduction in the movement. So that's what there's a slight reduction in the spontaneous movement. Before it was a spontaneous movement, here slight reduction has happened, not much. Okay. Then when you speak to the child, he can speak it back. Okay, but we don't want that. We don't want that. Then the patient is slightly relaxed, but still stubborn. Blink rate will be there, but slightly reduced. You cannot mark the difference here. But what exactly you can see is paresthesia on the fingers, toes, and the lips. They will be just putting their hands like this. Because you are not going to look into the BP or respiratory rate, that all don't require. First thing, the reduction in the spontaneous movement and tingling sensation on the extremities. They will be just putting the hand, rubbing the hands, or rubbing the toes. Okay. Sometimes they relax, and because before that there will be closed legs. Slightly they relax and get. The shoulders will be just drooping down. Slight reduction in the drooping of the shoulders. These are three things you look into the patient. Fine.
Very good. Okay, now relax it. So നമുക്ക് നോക്കാം ഇവിടെ വെച്ച് ഒരു കുഴപ്പമില്ല ഇതുണ്ട് ഷോ മീ ഹാൻഡ് ഞാൻ വെച്ച് കാണിച്ചു തരാം ഇതുണ്ടോ ആ കൈ ഞാൻ ദിസ് ഇസ് ദ ക്രീം ഐ വിൽ പ്ലേസ് ആ രൂട്ടിൽ അങ്ങനെ വെക്കും.
Before I showing into that, those who have experienced nitrous oxide out here, right? They are here. Yeah, now, right now. Please come. Yeah, Mike. What's your name? Sorry? Millie. So you have experienced nitrous oxide,
Yes,
right?
sir. Yes, sir.
So what was your experience? I wanted to start this before the, yeah.
ഞാൻ മലയാളത്തിൽ പറയാം, കംഫർട്ടബിൾ ആണ്. ഞാൻ അവിടെ പോയി കിടന്നതിന് ശേഷം എനിക്ക് ഫീൽ ചെയ്യണം എന്നുള്ള ഒരു ഇന്റൻസിറ്റി തന്നെയാണ് അവിടെ കിടന്നത്. അപ്പം എനിക്ക് ആദ്യം കുറെ നേരത്തേക്ക് പ്രത്യേകിച്ച് അങ്ങനെ ഒന്നുമേ തോന്നിയില്ലായിരുന്നു. ഒരു പോയിന്റ് എത്തിക്കഴിഞ്ഞപ്പോൾ ഞാൻ ഓർത്ത് തുടങ്ങാൻ പോവാണ്. കാര്യം എനിക്ക് മൊത്തത്തിൽ ഒന്ന് ഒരു കളർ ലൈറ്റിന്റെ ഇന്റൻസിറ്റി ഒന്ന് കുറഞ്ഞ പോലെ തോന്നിയായിരുന്നു. അപ്പം ഞാൻ ഓർത്ത് ഇപ്പം എല്ലാം തീരും. പക്ഷെ കുറച്ചു നേരം കഴിഞ്ഞ് കഴിഞ്ഞപ്പോൾ ഞാൻ ഭയങ്കര കോൺഷ്യസ് ആയിരുന്നു. പക്ഷെ ഒരു സ്റ്റേജ് ആയി കഴിഞ്ഞപ്പോഴത്തേക്ക് എനിക്ക് കാലിന്റെ മസിൽസ് ഇങ്ങനെ ഒരു വെയിറ്റ് ഫീൽ ചെയ്യാൻ തുടങ്ങി. അപ്പൊ ഞാൻ അത് ഇൻഡിക്കേറ്റ് ചെയ്തു എനിക്ക് കാല് എനിക്ക് അതിനുശേഷം മുതൽ ഇപ്പം നമ്മുടെ ഈ ഇയർഫോൺസിലൊക്കെ നോയിസ് ക്യാൻസലേഷൻ കേൾക്കില്ലേ, എന്നിട്ട് നമ്മൾ സൗണ്ട് കേൾക്കുന്നതും അതിന് മുമ്പിൽ സൗണ്ട് കേൾക്കുന്നതായിട്ട് അത് എക്സ്പീരിയൻസ് ചെയ്തിട്ടുള്ള കാര്യം ഇപ്പം ആ ഒരു സ്റ്റേജ് ആയി കഴിഞ്ഞപ്പോ അപ്പോ ഈ ഒരു അതുവരെ എനിക്ക് എല്ലാം എയറിന്റെ സൗണ്ട് ഭയങ്കരമായിട്ട് കേൾക്കുന്നുണ്ടായിരുന്നു. ആ ഒരു സ്റ്റേജ് ആയി കഴിയുമ്പോൾ എയറിന്റെ സൗണ്ട് ഇല്ല, ഭയങ്കര എക്കോ ആണ്. ഒരു പിന്ന് വീണ അതുവരെയും കേൾക്കാൻ പറ്റുന്ന പോലെ ഭയങ്കര നന്നായിട്ട് എനിക്ക് കേൾക്കാൻ പറ്റുന്നുണ്ടായിരുന്നു. ചെവി ഇങ്ങനെ നമ്മൾ ഈ കയറ്റം കയറുമ്പോൾ ചെവി അടയ്ക്കത്തില്ലേ, അടഞ്ഞു കയറുന്ന പോലെ കേട്ടു. പിന്നെ അതിനുശേഷം ഇങ്ങനെ നല്ലൊരു സുഖം ഉണ്ടായിരുന്നു ചെയറിൽ ഇങ്ങനെ കിടക്കാൻ. വെറുതെ ഇങ്ങനെ നമ്മളിങ്ങനെ ഭയങ്കര ഇവിടെ നിന്നൊക്കെ എന്തോ ഇങ്ങനെ പോയ പോലെ തോന്നി.
എന്നിട്ട് അവിടെ വെറുതെ കിടന്നു. ഇച്ചിരി നേരം കഴിഞ്ഞപ്പോഴത്തേക്ക് ബാക്ക് ടു നോർമൽ. വളരെ പെട്ടെന്നായിട്ട് എൻ്റെ അടുത്ത് ഇവർ പറഞ്ഞു മാറിക്കൊണ്ടിരിക്കുകയാണ്, പക്ഷെ അതിന് മുന്നേ ഞാൻ ഓക്കെ ആണ്.
Thank you, doctor. Now, see, now that's in plane one. She was only in plane one. I don't know how much percentage of nitrous was given to you. How much it was given? Any idea? 70. After 70 also she was plane one. Sir was asking me how to go to plane one, plane two. So much of, I mean, 70% of nitrous oxide she was received, but still she was in, maybe. Okay, because there can, if the mask is not proper, then there can be leakage. All right, so the patient was still in plane one, not gone. So the basic thing in giving nitrous oxide, you should know, you should be able to identify which plane the patient is. Then only you can do the treatment. Right? Now, the plane two. Plane two, it's from 20% to 55% of nitrous oxide when you give. Okay. So there further relaxed, sleepy with reduced blink rate. Okay. The blink rate further comes down. Patient slightly finds difficulty in opening the eyes. That is why it's called sleepy. It's not they're sleepy, but it is difficult for them to open the eyes and keep it. They find it heaviness on the extremities. Okay. I think that a little bit she might have got it. Okay. That is between plane one and plane two. It's very difficult to raise your hand or lift your leg. Difficulties in extremities that you feel. The pain threshold have increased a lot. Okay. For a normal adult patient, if you want to give a local anesthesia, this plane you can give it. But heavily anxious patient, no, don't touch. Okay. But for a mild patient, mild relaxation, you can give a local anesthesia. Then the pharyngeal reflexes reduced, but laryngeal reflexes remain intact and unaffected. Patient is not able to swallow the saliva properly. Okay, but they can speak. They can understand what you speak. They can response. They can give a response to you back. Okay. They can maintain the mouth open. All right. Then they feel detached and widespread paresthesia among the fingers and lips. So here the patient just rubs the face. When you look at them, they'll be just rubbing out here on the faces. The extremities, the paresthesia have increased. All right. Abnormal hearing sensation, taste and vision. That's what she said. Hearing differences is there. Okay. Here, first one, when you ask how many friends? One. Second, plane two. Plane three. This will be the response, body movement. Right? And I think this video is not fully played, right? To play Jana. You can see the video.
Very good. Okay, now relax it. So നമുക്ക് നോക്കാം. ഇവിടെ വെച്ച് ഒരു കുഴപ്പമില്ല. ഇതുണ്ട് ഷോ മീ ഹാൻഡിൽ ഞാൻ വെച്ച് കാണിച്ചു തരാം. ഇതുണ്ടോ ആ കൈ കാണിച്ച് ദിസ് ഇസ് ദ ക്രീം ആൻഡ് വെൻ പ്ലേസ് ആ ടൂട്ടിൽ അങ്ങനെ വെക്കും. അത്രേ വെക്കുള്ളൂ. ഓക്കെ.
plane 3. I think he has already attended the classes, right? I have attended the classes. But still, want to give you experience? Fine. Now, plane 3, where you give more than 50% of nitrous oxide. Okay. So here, the patient feels sleepy. Difficulty in opening the mouth will be there. Here, actually, this plane, we don't require it because we want our patients to open the mouth and sit, right? We don't want our patients to close the mouth and sit. Okay? But they find it difficulty in opening the mouth, but still the patient sometimes responds to the verbal commands. Sometimes they lose the verbal commands. Okay. And very sleepy, patient will very sleepy. That's what. In plane 3, the patient is going to sleep. Okay. We want our treatment to be in plane 1. Sometimes if you want to give a patient with highly uncooperative patient, you can give local anesthesia in plane 3. Right? But then you need to bring back to the child to the plane 2. If you want to do any treatment, you need to bring back the child to plane 2. Okay. See? No, actually, I didn't want to go to take it in, but see, when you do the treatment, sometimes the patient goes to plane 3, even for with the 30 or 40% of nitrous oxide, he might go to plane 3. Okay. I need to bring it back, immediately reduce it, and I need to bring it back. That's it. It's not that I intentionally taken him to the plane 3, but that small amount of nitrous oxide was enough for him to go to plane 3. We can do. But if the patient is very uncooperative, especially for local anesthesia, okay, you need to take the patient to plane 3 to give local anesthesia. Back. So stage 2, actually we don't require it. The patient is going to sleep. Okay. And sometimes the response to the verbal commands is lost. Okay. When the verbal commands it is lost, you need to check for the respiratory rate and saturation rate. Keep on monitoring the patient. But this is not going to do anything with any complications or anything, but it's going to a deeper stage of sedation, which we don't actually require for any of the dental procedures. Right? So this is the maximum thing a nitrous oxide can do. Maximum stage of anesthesia. It cannot go to the surgical level of anesthesia. Fine. So that is why we say when you do a dental treatment, you need to give local anesthesia along with nitrous oxide. Many of you think that, okay, if I give nitrous oxide, do I need to give a local anesthesia? No, you need to give local anesthesia because you are not taking the child or the patient to surgical anesthesia. Fine. We'll have a coffee break and then continue.
We'll have a short tea break now. Tea will be served outside the hall. We can assemble after 10 minutes.
Shall we start? Fine. So here we have another one more experience with the nitrous oxide. Okay, direct experience. I ask Dr. Rajiv to give his experience on nitrous oxide.
എനിക്ക് ഫീൽ ചെയ്തത് ഒരു യൂഫോറിക് സ്റ്റേജ് ആണ് ലൈക്ക് ടിംഗ്ലിംഗ് ഒന്നും അറിയാൻ പറ്റിയില്ല ജസ്റ്റ്
Shall we start? Fine. So here we have another one more experience with the nitrous oxide. Okay, direct experience. I ask Dr. Rajiv to give his experience on nitrous oxide.
എനിക്ക് ഫീൽ ചെയ്തത് ഒരു യൂഫോറിക് സ്റ്റേജ് ആണ് ലൈക്ക്
കഴിഞ്ഞോ കഴിഞ്ഞോ കേട്ടില്ല ഇവിടെ ഇട്ടോ. So Rajiv, in the beginning, how it was for you?
ബിഗിനിങ് ജസ്റ്റ് ഒരു ചെറിയ തല ഗിഡിനെസ് ആണ് ഫീൽ ചെയ്തത് ജസ്റ്റ് ഗ്രാജുവലി ലൈക്ക് സ്റ്റേജ് ഓഫ് യൂഫോറിയ പോലെ ലൈക്ക്
Okay.
എല്ലാം കറങ്ങുന്ന പോലെ ഒരു തോന്നലാണ് ഫോളോഡ് ടിംഗ്ലിംഗ് സെൻസേഷൻ ഒക്കെ ലോസ് ആയി Like, പിന്നെ ഫ്ലോട്ടിംഗ് സെൻസേഷൻ ക്ലീൻ
And I'm asking initially how it was, because this is at the end of your,
Yeah.
or even the nitrous oxide has gone beyond 50%. Maybe how much was given for him? 60, 30. That is, here is an different experience. He got the hit at the 30%. Before it was 70%. For him it is 30%. So 30%, initially you had tingling sensation, right?
yes
Yeah, after that,
gradually we lost that sensation and like
so that is at 30%, he had over sedation. This is the feeling of over sedation. And we don't require this, because once a patient gets over sedation, this is going to be a bad experience. And that bad experience, if a patient experience that bad experience of nitrous oxide, he will never again demand for it. 30% nitrous oxide, that is when we say it is plane 1, you will be able to reach plane 1, but he got the experience, or he is a hyper responder. The other one was hypo responder, where 30% was needed and still she was in plane 1 or between plane 1 and plane 2. Here, hyper responder, where 30% itself made him to an over sedation. Fine. So that was a different experience for him. Now let's, thank you, Rajiv. Now let's move on to the equipment. Okay, we have different equipments available. Okay, so Baldus is a German company. Okay, and you have Matrix, another. I think it's a foreign country, right? And the department has got the Matrix. Okay, and those who are able to, very rich, they can afford this. Okay, because it's costly. It's one is German company, and then we have a concept, another machine. It's purely Indian make. Okay. Thing is, whenever you buy an equipment, basic thing you need is service. Proper service you need to get. So you can choose any company depending upon the amount you have in your pocket. But at the end of the day, if you don't have a proper service, then you will be in trouble. And that, I think that is the reason why many of the colleges, why the machine is in one corner of the department. Maybe where whom all I have interacted, they all said we are not having a proper service. At the proper time, we are not getting the mask, or you have the changes in the regulator. You need to change the regulator routinely, or the head. If there is any problem with the head, if there is any mixing problem, you will have problem. Okay, you will find difficulty. So once you find difficulty, slowly you will lose the confidence or use the because definitely sometimes you can manage a pediatric patient or any patient, but the ease or comfort of this machine you might lose. And again, the cost. I think the matrix it's going to cost. I think maybe 5 lakhs, where this you might get it for 2.5, 2.8. I don't know. That you need to the company person directly. But even the mask itself. See, this is the mask, autoclave mask you get. Okay. This is going to be too costly. Okay. I think normally it is going to cost some 80,000 or something. 80,000. Whereas this is the matrix autoclavable mask, 80,000 or something about that. Whereas with this company, you get say probably 30 or 40,000. And even the disposable mask, which you commonly we use. Okay. So this is going to be 400 rupees. And all together, along with the gases, 500 or something. Okay. So when it comes to the cost of the patient, when you how much they most of the time they are ask me how much you are going to charge. Okay. So this is the initial investment which we have. When we have a more costly thing, that has to automatically will be transferred to the patient also. So you need to think onto that. Do I need to explain the matrix or this one? Which one? Anything I'm comfortable. So this is another company. You have Concept, an Indian make, I said. And coming to the parts, this is called the backbone. Okay, this is part is called where all the attachments are attached to the backbone. Okay, this is called the yoke of the machine. And you have cylinders. You have an oxygen cylinder and you have a nitrous cylinder. Okay, first thing is it is color coded. For the safety mechanism, it is color coded. Always the nitrous is in blue color and the oxygen is in white color. Same like our LPG gas. LPG, you have your homemade, for home you have red in color, whereas for the domestic purpose you have blue. Commercial, commercial you have blue in color. So the same way for the safety methods, you have blue and white. You don't like blue, so you cannot paint pink. Right? All right. And yes, definitely. All over. It's blue and white. In India, that is the standard safety mechanism. It's given for nitrous. Okay. Second thing, you have pin index safety mechanism. That's why I said the safety mechanisms for this machine, even if it's a matrix or anything, you have the same international code of safety mechanisms. So you have pin index safety mechanism where the pin index for the nitrous is very close, whereas for the oxygen, it's far away. Okay. So this is the female part. When you have in the male part, you can't never interchange that. You cannot interchange the oxygen with the nitrous. All right. So that is another safety mechanism. And the next one is diameter index safety mechanisms. This is the nitrous tube. You cannot fit onto the oxygen one. Fine. So these are the safety mechanisms. And again, you have another 2 extra cylinders can be attached to the yoke. You know why? Because why? Sometimes if the nitrous or oxygen is getting depleted, okay, you cannot wait for some more time for the next cylinder to come, because the action is only 2 minutes or 3 minutes. After that, the patient comes back to the normal one. So as soon as you know that your gas is getting depleted, you need to switch on to the extra one. Fine. But In the middle of the procedure, if you mix it, then it's going to get mixed with both the cylinders. You'll be in trouble. Not in trouble. Actually, you don't know where the gas is being depleted. All right. Now the oxygen, it's in gaseous form. Oxygen is in gaseous form. So when the gaseous state of oxygen is depleting, this gives its correct reading. From first reading, it will be 2000. Sorry, 1 second. 2000 psi is the pressure. Okay. So once it is depleting, it's slowly depleted down. Whereas the nitrous, it's in liquid form, same like our LPG. Right. So whatever the gas on top, it will be the same. Your liquid is going to get depleted. Right. So when it comes to 1/5 of the cylinder, then only suddenly there will be a reduction in the gauge. So you should look onto this and the time at which you use the nitrous. Sometimes say nitrous, it will go for 6 hours. This cylinder is going to go for 6 hours, whereas the oxygen it's go for 3 hours. So 3 hours after that you can have a correct reading onto the machine for oxygen, whereas for the nitrous you won't have a correct reading. So you know that after 6 hours, if you need to have the next cylinder standby. Fine. Then you have regulators. This is the regulators out here. 2 regulators. So one is 2000 psi and the nitrous is going to be in 750 psi. So that forceful pressure you cannot directly give it to the patient. So it has to be reduced to 50 psi. So that is why you have the regulators out here. Good. And you might have hissing sounds. That is leaking of gas. Okay. If you have a hissing sound, that can be from the cylinder to the regulator. In between that, there can be anywhere, there can be a leakage. That is the hissing sound comes from. Okay. But sometimes there is no hissing sound, there is no sounds. That can be the leakage of gas can be from anywhere from the regulator till the nose. Okay. There can be a break in the tube. Okay. Here the seal won't be proper. There can be leakage of gases. Fine. Now this is the head of the instrument. Okay, where the mixing takes place. So you can say this is cold water, this is hot water, this is hot water, this is cold water, whatever it is. Okay, so this both are mixed in proper form. Okay, for that you have a flow rate. This is where you have a flow rate you can maintain. So once you have a flow rate is maintained, say for a patient of adult patient, the flow rate may be 6 or 7. So how do you calculate the flow rate? It is weight into respiratory rate into tidal volume divided by 1000. So that is going to be the flow rate of for a particular patient. Okay. Therefore, children it might be between 4 to 5 liters per minute. That's the flow rate. So you check the flow rate. After once the flow rate is maintained, you are not going to change it. Flow rate is going to be same. Okay. Then slowly you start mixing the nitrous oxide. So this is the mixer one out here, the small one. Out there, I think people may not be able to see, right? So this is the mixer tube. Okay. Then you slowly start mixing the nitrous onto it. Slowly 10%, 20%, 30%, 40 to 70. 70 is the maximum. You won't be going, you can't be go beyond that. You have either autoclavable mask will be there, or you have disposable masks. Right? So this is the machine which you have. Anything more you need to ask on the machine? Yes, of course. See, normally you can ask the nearby hospitals from where they get the oxygen and the nitrous. Okay, there will be always suppliers. So for a particular town, there will be a supplier. So you can easily get it from them. Anything to the machine? All right. So before you start with any patient, in clinic when they come, you should ask the anxiety level of the patient. So if the patient is anxious, okay, that's Norman's anxiety rating scale is there. That is for any patient. That is for either pediatric patient or adult patient. You have a set of questionnaire you ask to the patient. So do you find your dental treatment anxious for tomorrow? Or do you find feel like getting pain while giving local anesthesia? How do you feel your experience with the dental treatment? So you ask everything. So then the rating scale, you have 5 questionnaires. In that, say if you want, if you want to go to a dentist for dental treatment, how do you feel? Not anxious, slightly anxious, fairly anxious, very anxious, extremely anxious. Depending on that, the score is from 0 to 5. Okay. If the score is more than 19, definitely your patient is an anxious patient. He requires a nitrous oxide. So that is an indication. Okay. So if the patient is very anxious, definitely he will be a candidate for the dental treatment. Then you need to assess the patient. That's what your case history. Never treat a stranger. That's what been taught to us in surgery. Okay, all proper case history has to be taken, whether the patient is taking any medications, whether the patient is having cold, cough, whatever it is, blocked nose. Okay, so the patient evaluation and assessment has to be done. Then proper case history for allergies, any medications. What we normally do it's not for the nitrous oxide, it's for all our normal procedures. Even for a local anesthesia, when you give, you ask the case history properly. So same thing, that's all. Then you need to have a consent. Before going for any treatment, any behavior modification also, you require consent from the patient. Same way for the nitrous oxide, you need to have consent. In my clinic, usually I go for local anesthesia along with the nitrous oxide. I don't have a separate consent form. So it is mandatory that if the patient needs a local anesthesia, even nitrous oxide is mandatory. Right? So a common consent form has to be given and consent has to be signed. Then before that, before the patient comes, you need to teach the patient what they are expected to do. Because in the middle of the procedure, you cannot ask the patient, you are not supposed to do this. How should I communicate with the patient? How am I going to feel it? So usually you should give a brief idea what exactly you need to do. Then NBO. There is no need of NBO, but the patient has to avoid heavy food. Heavy food they need to avoid. Okay, so that's the only thing. Otherwise, there is no NBO need to be followed. Then sign languages, how the patient has to respond. If they find okay with the treatment, what exactly the sign language the patient need to respond when you ask. Because you will be always asking closed-ended questions. You are not going to ask open-ended questions. Fine. So you will be always asking closed-ended questions. In that, how the patient is supposed to answer to you, he should be taught in advance. Next, emptying of the stomach. Because in the middle of the procedure, they should not say, doctor, I need to go to the toilet. Fine. So if at all anything is there, ask the patient to empty the bladder and come sit for the procedure. Next, position. Always supine position will be the best way to give a nitrous oxide, not in sitting procedure. 90-degree procedure, it is not, it's very difficult to work on a nitrous oxide. Then ventilation in the room. It should be nicely ventilated. If ventilation is not there, you need to have a removable exhaust fan. Okay, removable exhaust, or if you put an exhaust fan, it should be at the floor level. It's not the normal exhaust fan, you keep it on the top level. It should be in the floor level, because whatever the nitrous I said, the density of the nitrous is down. Okay, more than the air. So it is going to be in the floor level. So you need to have an exhaust fan, which is portable type. Then cross ventilation. If you don't have a cross ventilation, you can have a pedestal fan kept in the opposite way, so that whatever the nitrous oxide nearby can be flown away. And you need to teach the suction, how to do suctioning. In the middle of the procedure, you cannot take a suction tip and then put it in the patient. They might get anxious. So you need to teach the child how suctioning has to be. And you have the conduction tubule along with the reservoir bag. Okay, reservoir bag is something where you can see the patient how it is they are breathing it. Okay, so it's like it is connected out here, reservoir bag connected out here. So if it is over, so yeah, fine. Nasal hoods. Can I have the demo directly? It's better to have the demo directly. Anyone out there voluntarily sitting for the demo? Come. Yeah. Sit. Sir. Deepak. ഒന്ന് റിക്ലൈൻ ചെയ്യാവോ? ഇത് വേറെയാണോ? ന്യൂ വൺ. Doctor, show me your nose. Small, I think. No. First is selection of the nasal hood. Okay, selection of the nasal hood. So you can ask the patient to participate for that. All right, you can select how do you feel it, their nasal hood. You have 3 different sizes: small, medium, and large. Okay, you place it in your nose. Place it in your nose. Fine. Is it tight? Yeah. So selection of the nasal hood is the first thing. Okay, lay down. And now lay down. Supine position. Yeah. Okay. Slightly tighten. Is it tight? Fine. You're okay. Fine. Now to open the cylinders, you need to open anti-clockwise. Fine. This is anti-clockwise. To close, it is clockwise. Okay. Both the cylinders are opened anti-clockwise. Now see the readings. How much is the gas inside? It is 2000 psi in oxygen, whereas we have 750 psi in nitrous. So both the cylinders are full. Fine. Now slowly start the flow rate. Okay. So flow rate, I said usually commonly it is going to become 6 to 7 for adult. Okay. But still you ask the patient how do they feel. Okay. Because theoretically what they say, but sometimes the flow of the gas will be less. Sometimes the flow of the gas will be more. Okay. So you ask the patient how do they feel it. So slowly increase it to 6 to 7. Now it is 6 to 7, flow rate. Can out there people can see out? Back. I think it is difficult. Okay. Fine. How do you feel? See, it's 5 cycles you should wait. 5 seconds you should wait. See, I can demonstrate to you later in batches. Fine. You can focus on to this from where the camera is coming. All right. So to open, I said counterclockwise. You have seen. Fine. I will show in batches. That will be fine. Okay. So flow rate, you have made it to 6 to 7. Okay. Now ask the patient. You don't worry. Nothing I have given him. Okay. Don't worry. She already started sleeping. Fine. Now you should not open your mouth. Okay. If at all you want to speak anything, if you find it difficulty, you show me like this. If you find it okay, you can show it like this. In between that, if you want to stop, fine. These are the basic things. All right. You should not open. You should not ask anything to me, to anyone. All right. Fine. Now you can speak, like I say. Okay. So how do you feel the gas coming inside? Slow, less, slow. Have increased a bit more. Say probably 9. Wait for 5 seconds. Okay, 5 cycles you need to see. Now how do you feel? Nothing. Nothing. Have increased. You find the flow rate is more gas coming inside. Okay. Now, no, wait. Because it's 9. Okay. 9 is high flow rate, which is actually not indicated. Okay. For her, she was finding it okay. But see, this is how you adjust the flow rate. Okay. So I have made it 8 now. How is it now? You can speak. Nothing. Okay. How? Okay. No. No. Increase. Sir, bag. No. More. Less. It's okay. Sir, bag out here. I think. It has to be removed. So, no, I like it's fine. Leave it. Leave it with it. How is it now? No, that's what I'm asking. Air is coming or not? It's more or less. It's okay. Fine. Now wait for 1 to 2 minutes. Okay. Wait for 1 to 2 minutes. Your oxygen is going. Okay. Now you should not start You should not speak. Fine. All right. Okay. All right. Now I started mixing it. Okay. I'm going for mixing the nitrous. At 10%. Okay. Wait for 3 minutes. That's a normal way that it's been taught. Slow induction technique. So 10%, wait for 3 minutes. Okay. But usually, see, I said plain one, nothing is going to work. Okay. So you are actually going to waste your time with the patient. Okay. So just 1 minute in 10%. Then can someone look into the timing? Wait for 1 minute. So now it's 1 minute. Okay. Change to 20% of nitrous. Again, wait for 1 minute. Usually they say wait for 3 minutes. Okay. From 10 to 20, you should wait for 3 minutes. But as you know that it's not going to a correct plane because we wanted the treatment to be started fast and the action of the nitrous oxide to be fast. Okay. So nothing much can be accomplished with plane one. Fine. So that is why I'm not looking into the patient also. But you should keep on looking into the eyes of the patient, see the blink rate of the patient, okay, and how the patient is holding the mask. After some time, she finds it difficult to hold the mask. Okay, that out. So can somebody will be here to help her out? Just you hold the mask. You hold the mask. Slowly. Sit here, ma'am. You can sit here. Now it's 2 minutes. Okay. I'm going to 30%. You can sit there, that will be better. Slowly hold it. Now it's almost 3 minutes. Okay. So now you are waiting in 30% for 3 minutes. No changes with the patient. Blink rates going to be the same. Now, if you look into the eyes of the patient, the blink rate have reduced a bit, but not much. So now from 30 to 40, I'm changed to, now it's 3 minutes. So I'm changed to 30 to 40. See, I've fixed the flow rate out here. Okay. Now the flow rate, I'm not doing anything. The flow rate need to be constant. Fine. Only you are increasing the flow of nitrous. You are not changing the flow rate of oxygen. Now slowly look into the extremities of the patient. Okay. Not finding much. But eyes almost the blink rate have come down. Dr. Ardi, how do you feel now? See the hand movement. She is not able to lift the hand. You want to lift the hand? See the movement. Now she might be in which plane? Between 2 and 3. Because now, if at all anyone wants, you can see the eyes blink rate. Okay, almost nil. Almost nil. Okay, so the patient is in between 2 and 3. Patient is in between 2 and 3. The movement have reduced a lot. Okay, eyes almost fixed. Okay, glossy eyes. That's called glossy eyes. And you can do the treatment at this point of time. If you want to give a local anesthesia, you can give. Someone wants to pinch her? Anyone? Pinch, 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 pinch. If you have pain, you lift your hand. With your nail, you pinch. See. Done? Enough. The rest of the story you both manage. Now it's 3 minutes. So you don't want to take the patient further into the deeper levels. Okay. So what treatment? You want to give a local anesthesia, you can give a local anesthesia. After you are giving local anesthesia, now it's in 40%. Okay. Now you want to do any cavity preparation or scaling or extraction, whatever it is, you can bring it down. Because you don't want to take the patient into plane 3. You want always the patient to be in plane 2, where you have the most good effect of the nitrous oxide you can have. Okay. So you bring it back. If you want, you can bring it back. Fine. Suppose your treatment is over or nearing to end. You can, now it's not the way how you have taken it up. Just bring it back to 0. Back to 0. Okay. But ready. Fine. Wait for 5 minutes. Post oxygenation should be minimum for 5 minutes. After the end of 2 minutes, all going to be back to the normal. All right. So wait for another 3 minutes more. Post operatively or post oxygenation 5 minutes minimum you need to give it. Time 5 minutes. So here right now, 100% oxygen is going on. Yes. To prevent the diffusion hypoxia, you just back to the normal. And make sure when you give nitrous oxide, you should not create roller coaster effect. That is, you have taken the patient to 40 or 50. Okay, then bring it back to 30. Again taking it to 40. Then bringing it to 30. Again taking it to 50. You should not do that. That is going to have roller cost effect. Okay, the patient is going to have nausea, vomiting. Sometimes the patient is going to vomit. Okay, because your labyrinthine system is going to get affected and feels nausea, vomiting. If it is a long procedure, okay, you can, as long as you finish your treatment, you can continue the nitrous oxide. Unless and until you don't take the patient to plane 3. You don't want your patient to sleep. Okay, you want your patient to open the mouth and sit. For that, you can give how much ever time you want till you finish your complete your treatment. That's all. There is no particular time you should give for half an hour, you should give 1 hour. That's all depends upon the procedure what you do. Now she is back to her blink rate. One more minute. 2 minutes. How do you feel, doctor? See the thumbs up. Fine. Any questions you need to ask onto this? I can give in small groups demo. Okay, or you yourself can do it. From the department, anyone can do it. Okay. Who wants to work on the next person? If you have one more chair can be placed out there, and then 2 demo at a time it can go. It's almost 5 minutes. It's almost 5 minutes. You can remove the mask. Fine. Sit straight. Sit there for 5 minutes or 2 minutes. All right. And how do you feel now?
Perfectly all right. Perfectly all right. Nothing.
Nothing.
Touch area, but pain illa.
Didn't finish or you? Now, how did you feel it out initially, how it was, and till the end? Can you just describe?
Initially, ഒന്നും അറിഞ്ഞില്ല. Just ഒന്നും അറിഞ്ഞില്ല.
Okay, fine. Now it is 0. Okay. Now I need to make the fluoride. The gas is flowing. Even the nitrous, sorry, the oxygen, it has to be closed. Okay. Once the fluoride is closed, and again you need to close the valve for the nitrous oxide. So to close clockwise. To clockwise. Both. It's not that there is a nitrous leakage will be there, because once you have cut down made it to 0, then there is no flow of nitrous, but the oxygen you will be just losing it. Fine. Yeah, you can hear.
Initially, ഒന്നും തന്നെ എക്സ്പീരിയൻസ് ഉണ്ടായിട്ടിരുന്നില്ല. പിന്നെ കുറച്ചു നേരം കഴിഞ്ഞപ്പോൾ കാലിന് നല്ല തണുപ്പ് തോന്നി.
പിന്നെ ആ ഒരു ടിംഗ്ലിംഗ് സെൻസേഷൻ എനിക്ക് ഹാൻഡിലും ഉണ്ടായിരുന്നു, കയ്യിലും ഉണ്ടായിരുന്നു. സ്റ്റിൽ എക്സ്ട്രിമിറ്റീസ് കോൾഡ് ആണ്. ദെൻ ഞാൻ സീലിംഗിൽ നോക്കിക്കൊണ്ടായിരുന്നു ആദ്യം എനിക്കിതെല്ലാം ക്ലിയർ ആയിരുന്നു. പിന്നെ പതിയെ എനിക്കത് ഡിഫറൻഷിയേറ്റ് ചെയ്യാൻ പറ്റുന്നുണ്ടായിരുന്നില്ല ഈ മാർക്കിങ്സ്. എനിക്കങ്ങനെ ഒരുപാട് ഗിഡിനെസ് ആയിട്ടൊന്നും തോന്നിയില്ല, ഈ ഒരു ഇത് മാത്രമേ ഉണ്ടായിരുന്നുള്ളൂ. പിന്നെ പിൻ ചെയ്തത് ചെറുതായിട്ടാണോ പിൻ ചെയ്തതെന്ന് അറിയില്ല, എനിക്ക് ആ ടച്ച് അറിയായിരുന്നു, ബട്ട് പെയിൻ ഇല്ലായിരുന്നു, ഒട്ടും പെയിൻ ഉണ്ടായിരുന്നില്ല. ആൻഡ് നൗ പെർഫെക്റ്റ്ലി ഓൾ. താങ്ക് യു.
Thank you so much for the feedback. And you find it all normal, right? So the recovery is too fast, right? So how much time maximum we have taken? 20 minutes, half an hour? The action, 10 to 15 minutes. Okay, that is why I said you don't have to wait in the plane one, say 10%, you need to wait, you don't require to wait for 30 minutes, sorry, 3 minutes, or for 20, you don't require to wait for 3 minutes. Okay, so by 3 minutes, you will be in 30%. All right. So who wants to take hands-on session? Can we have Sajina ma'am, Pedo HOD to? Ma'am, you come, nothing, come. You don't have to worry about, nothing is going to happen. So ma'am is going to do the operate the machine. Who else? Who wants to come? Deebu. Deebu is my student in Alasa. Oh, no. So ma'am is going to open the nitrous oxide cylinder in anti-clockwise. Yes. Fine, fine, ma'am. You see the reading, 750. Same oxygen. Yeah, that's fine. Now, next one is flow rate. Flow rate is the flow rate meter, anti-clockwise. Everything is going to be opening in anti-clockwise. Yes. You didn't open, open. Yeah, slowly see, now it's going. For an adult, 6 to 7. 6 to 7, 6 to 7. All right. Just wait there for 5 seconds and ask the patient how is the flow of oxygen. Now it's only the oxygen is flowing. Okay. So how do you find it now? Okay. And you can still increase it further. 8, 8, 8. Go till 8. You want more, you want coming down because see the flow is more. Bring it down, man. Bring it down to 6 to 7. Yeah. Fine. So she find that 6 to 7 flow rate is comfortable for her. All right. Now you are not doing anything. You are not going to touch the flow rate. Okay. This is the volume of water coming from a tap. Okay. You have now fixed the volume of the tap water. Okay. Now next one with this nitrous oxide, you are going to mix it with cold water or hot water. Now the cold water, your volume you have established. That's what happened right now. Now you are going to you need to add hot water to it and more down. Now you wait for 5 minutes, 5 seconds, ma'am. How do you find? All right. So now you can start mixing the nitrous. This one. Down. 10. Bring it. 1 minute, 1 minute. Little more down, little more down. Yeah, now it is 10. See, now here the flow rate it was before it was 6. Okay, now it has come down to 5. Here the nitrous has gone to 0 to 10. Now here you are waiting for how long? 1 minute. You're looking for the timer, don't worry. Now ma'am, you can change to 20. Keep one finger, that'll be fine. Don't press, don't press. Slowly, yeah. Oh, ma'am, you will be constantly looking into the eyes of the patient because that's the place where you see the difference a lot and fast responses you can see. Okay. Before how the blink rate was, now how the blink rate is going to be. Three minutes, ma'am. Now you can go to 30. This is now you are an operator. Okay. Now you keep on looking into the eyes of the patient and see the observation because you will be here also you are managing, they are also managing. So the next one you have an operator. Always you have an operator and an anesthetist, you can say. So anesthetist, if ma'am is the anesthetist, next person is going to become the operator. Operator is the one who is doing the cavity preparation, everything in your practice. Okay. So ma'am, as an anesthetist, she will be giving, she is looking into the eye movements and the body responses, everything. The rest person, once it is done, the operator can jump into it and then do the procedure.
That's what my clinic, my junior staff is doing it. So she's giving the nitrous oxide. Once she says that the patient in stay plane 1 or plane 2, then that's the time where I go and do the procedure. So I give a local anesthesia and then do the whatever the cavity preparation, whatever it is. Then finally hand it over the patient to her. So see here you need to have the work has to be divided into the persons. So you have an anesthetist, the anesthetist, whoever it is. Okay. Then you have an operator. Operator is the one who is doing the cavity preparation, whatever is what the procedure you are doing, extraction, whatever it is. Okay. So the anesthetist will be constantly evaluating the eye movement, extremities. So this you always will be watching it. So ma'am, this can be in plane 1. Slowly she has got the extremities tingling sensation. Okay. But when you look into the eye movement, the blink rate is the normal. Inside. 2 minutes. How do you find it, Doctor? Yes or no? See the movements. Just come down. Because why the patient is they find it difficult in lifting because they find heaviness on the hand. It's not that they don't want to lift it or not. They find it heavy out there. 3 minutes. Ma'am, you can go to 40. We are just trying to take the patient to stage 2. Okay. So the maximum extreme level of sedation you can just see. Okay. Which actually you don't want. You don't want actually that. That is going to become over sedation. Okay. So it's a bad experience for the patient. But let's see. Sorry. And the patient is more conscious now. That is why it's called conscious sedation. But ma'am, you will be watching the patient. Whoever is the anesthetist, they don't have any choice. Now see the blink rate. It has reduced. So what plane it can be in? Yeah, plane 2. See, when it goes to plane 3, automatically the eyes closes. Even they find it difficult to open the eyes and sit. So sleepy, it's not sleepy, but the patients find it difficult to open the eyelids. Okay, so that is plane 3. Or sometimes the eyes are fixed. Okay, when the eyes are fixed, it is in between 2 and 3. And end of plane 3, they are going to close the eyes. 3 minutes. 3 minutes. Timing of 2 minutes. You can't ask. No. You see the signs and symptoms, and then you come to a conclusion which plane is it. You cannot ask the patient how do they find it. Do they have the tingling sensation? Do they find it difficulty in lifting the hand? Nothing. You ask, and then you see the changes in the moment. Not ask, you observe and then see the changes in the moment. 3. Now we can take it to 50. After that, you should tell me whether you require an anesthetist or not. Now you are in 50. Okay. So 3 minutes, you are in, you came to 50. Now 50 to 55, you need to wait for 3 minutes. When you go beyond that, okay, 50 to 55, you need to wait for 3 minutes. 55 to 60, you need to wait for 3 minutes. 60 to 65, 3 minutes. 65 to 70, 3 minutes. Fine. From now on, every 5, middle. No, not now. Now, when you increase now, from 50 to 50, in between it should go. Now look at the eyes. Now she might be in between plane 2 and plane 3. Close, the eyes close. Now even she is going to become more conscious. Now she's like, I will not go to stage 2. That's what she's going to do. If you tell and do it. Now she's feeling sleepy. So she's in stage 3. Sorry, stage 1, plane 3. Even if she wants to open it by forcefully, she is not able to do that. She's getting into plane 3. Now, if you want, you can take it again to 25 more. Take, nothing is going to happen. Take. See, now she is in stage 1, plane 3. She's sleeping. Okay. I want me to cut it off? Nothing. Okay. Now, if you ask her, now she's going to come out. She's going to come out immediately. Okay. Now she is in stage 1, plane 3. Okay. We are trying to take her to stage 2 to make her sleep. Increase, man. Increase. Yeah. 55. Yeah. But we don't require this stage, because if I ask the patient to open the eyes, doctor, can you open the eyes? See, find it. Can you open your mouth? See, this we don't require it. You cannot do any dental procedure. Okay. But for any other procedures like any cosmetic treatment, hair transplant, okay, END or skin surgeries, if they want, they can take it into this level. We don't require it. Now we'll bring it back. Yeah, 0, ma'am. 0. Directly 0. Directly 0. Now see,
the nitrous is cut off. You know, nitrous is cut off. Now pure oxygen is going. Now look at her eyes. Immediately back. So how much time maximum? Again. Total how much? 20 minutes. 20 minutes, we have taken the patient to stage 2. Okay. Now, within 1 minute, we brought her back to normal. Okay, now slow back. Thing is that you should get rid of the fear. Okay, this is maximum this nitrous oxide can do, not more than that. And when you find that the patient is sleeping, okay, bring it back to the, see if it was in 50 or 55, bring it back to 40. Patient is going to get up, that's all. Now you are going to close the nitrous. Close to clockwise. All right, but oxygen 5 minutes more. Fine. How easy it is. I think madam has tensed.
But I will say after performing on pedo
On patient.
patients,
But what I initially say is, don't take any uncooperative patients initially. Take cooperative patients. Get the confidence of doing nitrous oxide. You get the confidence of doing it, say probably 5 or 6 patients. Later, you know how to handle it. It's like learning how to do a cycle drive. Okay. See, initially I've showed you. Okay. Yeah. Then you see, oh, driving a cycle, it's very nice. Okay. But when you get onto it, you have the difficulties. So slowly you learn safe manner, and then you can take the child, uncooperative patient also. So that is called rapid induction technique. So what I have told till now is slow induction technique. Okay. You also have rapid induction technique. Rapid induction technique is where when a highly uncooperative patient or highly anxious patient is there, you can directly put 70%. Okay. You are directly taking the patient to not 10, 20, 30 like that, directly 70 and making the patient direct into plane 3. So that the highly uncooperative patient become little, say I said difficulty in moving the hands or heaviness of the extremities, you feel it. Okay. You wanted the child to be like in that condition so that you can do the procedure. So once you have given local anesthesia and the patient is still calm down, you're bringing it down from 70, 60, 50 and complete of the procedure, then back to normal. So that is called rapid induction technique. 5 minutes over. Okay, now. Say the question is, how much do I charge for my nitrous oxide? Okay. I told you the cost of my expense. It's going to be like 500 rupees. Okay. This nasal hood is going to cost you 350 rupees. The oxygen cylinders, each time I refill it, nitrous, it is going to become 1,000 rupees and oxygen, it is 200 rupees. Okay. Oxygen, you can work for 3 hours, whereas nitrous, you can work for 6 hours. Altogether, 40 rupees, 40 or 50 rupees is going to become the cost of gas for half an hour. Okay. So maybe around, say 500 rupees is your cost of production. Now it is your choice to charge. I charge 3,000 rupees per hour. So that's what I charge. Additional is the cost of the treatment. Fine. Okay. 3 minutes. Ma'am, now you need to.
Sir, when we introduce something new to the pedo patient, obviously he's going to open his mouth. Is it fine if the patient opens his mouth when then what to do for that, sir?
Sir, again, for uncough patients, how many appointments are needed? Sir, because the patients who
Desensitization technique, everything I they will do it. For that, it's rapid immersion technique. Sorry, I didn't get you. I didn't get you. No, no, no. Because see, immediately the child will become again uncooperative. 70, 60, then it's 60 again, the child if it is cooperative, then you can slowly bring it down to 50, and then 60. No. It's the action time of 90%. So to the central nervous system where the action takes place, it takes 15 days. No, you need to wait more than that. More than that. Minimum 10 minutes. Yes. Till the patient goes to stage plane 3. So you should make sure stage patient. Then you can slowly bring it down. If you want, you can do a local anesthesia and then start doing the procedure. Slowly bring it down.